Hello students, a warm welcome to all of you in IT Lives Academy and also welcome to all in our 3 months online certification course on topic nanobiotechnology. In today's lecture, we discuss the role of nanotechnology in drug delivery. Okay, so we start today's lecture. Nanotechnology plays a most important role in drug delivery system. Okay, with the help of nanotechnology, we perform target drug delivery. We easily perform control drug delivery. Okay, this nanotechnology is a transformative approach. Nanotechnology is a transformative approach. With the help of nanoparticle, we improve way of the working way of drugs. We improve the working mode of by the help this nanobiotechnology provide a innovative way to improve the drugs administered, targeted and released property in the body. Okay, in nanotechnology we use the nanoparticles and nano carriers for the drug delivery system. This will decrease the side effect of drug and increases the administrated property, target drug delivery and control release of drug to the specific or diseased cells and tissues. Okay, in nanotechnology we deals or perform the application at the range of 1 to 100 nanometer, and 1 nanometer equal to 10 to the power minus 9 meter. Drug delivery system can be engineered to enhance the therapeutic efficiency of drug, reduce the side effect of drugs and improve the patient outcome. Okay, the basic aim of the basic aim using this nanotechnology in drug delivery system is to enhance the therapeutic efficiency of drug and decrease or reduce the side effect of drug and improve the patient's outcome. Okay, okay. In nanotechnology based drug delivery system, we deliver the therapeutic agent in more targeted and effective manner. Okay. In this approaches, we leverages the unique property of nanoparticles, and these properties their small size, surface characteristic, and ability to modify to overcome the many challenges in traditional drug delivery. Okay. We use this nanoparticle for drug delivery system because of their small size and surface area characteristic and ability to modify and also challenges overcome the challenges that were generated in traditional drug delivery system. Okay, this system can be improve the bioavailability of drugs, enhance their stability, and enable the control and sustained release. Okay, nanotechnology is a very nanotechnology is a transformative approach that are used to overcome the problem arises through the traditional drug delivery system. The basic aim of using this nanotechnology in drug delivery system to improve the efficiency of drug, reduce the side effect of drugs, and improve the patient's outcome. Okay. Now we discuss the property why we use this nanotechnology in targeted drug delivery system. First, specificity. Nanoparticle can be engineered to target the specific cell. First property is specificity. We design the nanoparticle according to the specific cells such as cancerous cells. Okay, simply suppose this is a cancerous cell. Now we design our nanocarrier according to this cell via the help of ligand and antibody. We simply suppose this is a nanoparticle. We suppose add the ligand on the surface of this nanoparticles according to this specific cell. Then we load our drugs into this nanoparticle or encapsulate our drug in this nanoparticle. Okay, then this receptor or nanocarrier directly this nanocarrier only attached with this specific cell. Okay, and perform their activity. This target drug delivery system is very important because this will minimize the damage of healthy cells and reduce the side effect of drug. Okay, next, enhance the permeability and retention. Nanoparticles are used to enhance the permeability and retention effect in tumor tissues because they allow the accumulation of preferentially in tumor site due to the leaking vasculature to poor lymphatic drainage. Okay, Next, controlled release. First, time release. We easily design the nanoparticle to release the drug payload gradually or in response to specific stimuli. To specific stimuli. These stimuli may be pH change, temperature change, and enzyme change. These we design the nanoparticles according to our requirements. Suppose we design a nanoparticles that release the drug whenever the pH changes. Suppose here I design a suppose we design a nanoparticle or nanocarrier. Whenever the pH is changed, then this nanocarrier release the drug. Okay. Suppose this suppose this is a cell and the pH of this cell is a 3. Okay. Now, due to the disease and due to the pathogenic attack, the temperature of this cell will increases and reach the 7. Okay. Now, we create a nanoparticles according to this cell. We create a nanoparticle or design a nanoparticle whenever the pH of this cell will change and reach to 7, then this nanocarrier release the drug. Okay. Whenever the pH is maintained at 3, then this nanocarrier does not release the drug. These nanoparticles release the drug whenever the pH will vary. Okay. This is a controlled release manner. Whenever the pH is changed, then drug is released. Whenever pH is maintained, the drug is not released. Okay, in this way, we perform the controlled drug delivery by the help of nanoparticles. Next, responsive delivery. We create a smart nanoparticles can respond to a certain environment trigger within a body, such as change in temperature in tumor environment, enzyme present in inflamed, inflamed tissues, releasing the drug precisely when and where need. Okay, we release the drug in controlled manner to reduce the need and frequently because we use these nanoparticles for controlled drug release because we want to reduce the need of frequently dosage and maintain the consistent drug level in blood stream. That's why we use this smart nanoparticle for control releasing drug delivery system. Okay. Next we discuss the improved drug solubility and stability. Suppose in market there are lots of drugs available that are hydrophobic in nature. Okay, hydrophobic means these drugs are poorly soluble in water. Okay, Due to this hydrophobic nature of drug, it limits the effectiveness of drugs. It limits the effectiveness of drug. Okay, but by the help of nanotechnology, we overcome this problem. How? We simply encapsulated encapsulate these hydrophobic drug on nanoparticle like liposome, micelles and polymeric nanoparticle. Now, due to this encapsulation, the solubility and bioavailability of the drug will increases. Okay, in this way, these nanoparticles or nanotechnology plays a most important role to overcome the hydrophobic nature, hydrophobic. In this way, nanotechnology plays a most important role for increasing the solubility of hydrophobic drugs. Next, we discuss the protection from degradation. Okay, mostly drugs are rapidly breaking. First, we discuss the protection from degradation. Drugs are the breakdown of drugs is very rapid, but by the help of nanoparticle, by the encapsulation of drug on a nanoparticle, we increase the circulation time of drug in blood stream. In this way, we increase the effectiveness of the drug. If we load or we inject the drug into the bloodstream, then this drug rapidly break down rapidly. But whenever we coat this drug on nanoparticle, then we decreases the breakdown time and increases the circulation time of this blood in blood stream. In this way, we increases the effectiveness of this drug. Okay, next, cross biological barrier, blood brain barrier. Nanoparticle can be designed to cross the blood brain barrier, allow the delivery of drug to the brain, which is traditionally challenges. This can be added to treat the neurological disorders like Alzheimer and cross biological barrier. Okay, first barrier is blood brain barrier. The treatment of brain related diseases very typical by the help of traditional method or very challenging, but by the help of nanoparticle we easily treat the neurological disorders because these nanoparticles are designed that easily cross these barriers and allow the delivery of the drug to the brain, and which is helpful to treat the neurological disorder like Alzheimer and Parkinson or brain related disorders. Okay, next, neurological disease like Alzheimer Alzheimer, Parkinson, and brain tumor. Okay. Next, cellular uptake. Cellular uptake. Okay. Nanoparticles can easily or rapidly penetrate or absorb via the cell membrane. Why? Because whenever we use the liposome for drug delivery system, then the composition of liposome and the composition of cell membrane is similar. That's why the cell membrane easily absorb this liposome, and this helpful for the target drug delivery and direct drug delivery into the target cells such as cancerous cells. Now we use the types of nanoparticles used in drug delivery system. Okay, first is a lipid based nanoparticle. The example of lipid based nanoparticle is liposome and solid lipid nanoparticles. Okay, these lipid based nanocarrier are used to deliver the hydrophobic and hydrophilic drugs. Next, polymeric nanoparticle. Polymeric nanoparticle composed with biodegradable polymer, that is a PLGA. PLGA stand for polylactic co-glycolic acid. These nanoparticles or these nanocarrier are used for controlled drug release and provide the protection of disease from degradation. Next, dendrimers. These dendrimers are the highly branched tree-like structure and also contain a central core that carry the multiple drugs and imaging agent. And these dendrimers are used to treat the complex diseases. Next, inorganic nanoparticles. Inorganic nanoparticles like golden nanoparticles, silica nanoparticle, and iron oxide nanoparticles are used to. These inorganic nanoparticles are used for imaging or combined with drug for synergetic therapeutic effect. Next, carbon-based nanoparticle such as fluorines, carbon nanotubes, and graphene oxide. These nanoparticles contain a high surface area. That's why these carbon-based nanoparticles used for the drug transport. Okay, lipid based nanoparticles used for deliver the hydrophobic and hydrophilic drugs. Polymeric nanoparticles used for the controlled drug delivery system. Dendrimers are used to treat the complex diseases. Inorganic nanoparticles are used for the synergetic. Inorganic nanoparticles are used for imaging and combined with drug for the synergetic therapeutic treatment. Carbon-based nanoparticles are used for the drug transportation. Okay, now we discuss the mechanism of nanoparticle for drug delivery. First, passive targeting. In passive targeting, we utilize or we first passive targeting. In passive targeting, nanoparticles are used to enhance the permeability and retention effect of the drug. Okay, and these nanoparticles are naturally accumulated in the area with leaking vasculature such as tumor. Accumulated in area with leaking vasculature such as tumor. Next, active targeting. In active targeting, we modify the surface of nanoparticle by the help of ligand and antibody for target drug delivery system. Next, control released. Okay, these are the three manner or three mechanisms which are followed by the nanoparticle for the drug delivery system. In first is in passive targeting. These nanoparticles are used to enhance the permeability and retention quality. In active transportation, we modify the surface of nanoparticle for performing the target drug delivery. In controlled release, we create a smart nanoparticle that releases the drug whenever the microenvironment of the cell is triggered. Okay. Now we discuss the advantages of nanotechnology in drug delivery. First, these nanoparticles these nanoparticles will increase the solubility and stability of the drug. Nanoparticles are used to by the help of nanoparticle we minimize the side effect of drug. By the help of nanoparticle we enhance the drug efficiency. By the help of nanoparticle, we release the drug in controlled manner. By the help of nanoparticle, we also protect the disease and increase the effectiveness of disease. These are the advantages of nanoparticle in drug delivery system. Now we discuss the administration of nano carrier. These nano carriers are used to deliver the drug. In administration, we involve the various method, formulation, and target strategies depending on the application and in administration, we involve the various method, formulation, and strategies that depend on the intended use and therapeutic goal. Okay. First, we discuss the administrative rule. First, oral administration. First, oral administration. Okay. Nanocarrier improve the drugs stability in digestive tract. Okay. Enhancing the absorption and can bypass the first metabolism and allow the drug to reach the target with high efficiency. In oral administration, these nanocarrier improve the drug solubility in digestive tract. Okay. Next, parenteral administration and intravenous. In this system, we directly enter the nanoparticle or nanocarrier into the bloodstream. Next, topical transdermal route. In this route or in this system, nanocarrier absorbed by the skin. Next, inhalation. In this process, nanocarrier is enter in the body by the help of respiratory tract. By the help of respiratory. Next, in this route we target the central. Fourth one is intranasal. In this system we target the central nervous system. By the help of this route we treat the neurological diseases. By the help of inhalation route, we treat the respiratory diseases. By the help of transdermal membrane, we treat the localized diseases. Okay. These are the route by which we transport the nanoparticle or penetrate the nanoparticle in human body. First is the oral. In this route we target the digestive tract. In parenteral administration we target the bloodstream. In transdermal we target the skin barrier. Inhalation we target the respiratory tract. In intranasal we target the central nervous system. First, injectable nanocarrier. Okay, in this system we directly inject the disease into the human body. Okay, these systems provide the benefits in terms of target drug delivery, controlled release, reduce the side effect and enhance the bioavailability. Okay, now we discuss the advantages of this injectable nanocarrier. First, enhance by the help of injectable nanocarrier, we enhance the target. Now we discuss the advantages. First advantage is enhanced targeting and efficacy. With their ability to target specific cells and tissues, injectable nanocarrier minimize the therapeutic effect while damage the healthy tissues. Next, control disease. Okay, injectable nanocarrier provide a sustainable and controlled drug release, which minimize the need for frequently doses and improve the patient adherence. Next, third is protection of encapsulation drug. Encapsulation provided by nanocarrier protect the sensitive drugs that are easily degraded by the different enzymes. For example, peptide is easily degraded by the peptidase enzyme. Okay, these sensitive disease are protected by the help of nanocarrier. Next, reduce the toxicity. By the help of nanocarrier, we easily reduce the toxicity effect of drugs. Next, reduce the toxicity. By the help of nanocarrier, we easily reduce or minimize the overall toxicity of the drugs. Fourth one is the reduced toxicity. While focusing the drug delivery on a specific site, injectable nanocarrier help minimize of target effect and overall toxicity. Next, reduce the toxicity. By the help of nanocarrier, we easily reduce the toxic effect and side effect of the disease. Okay, now we discuss the application of injectable nanocarrier. First, in oncology, nanocarriers are widely used to target the chemotherapy and reduce the adverse effect on healthy cells. Active targeting system help to deliver the drug directly to the tumor cells and improve the drug efficacy and patient's outcome. Next, cardiovascular disorder. In cardiovascular, these nanocarriers deliver the anti-inflammatory and anticoagulant drug directly to the site of injury and reduce the risk of systemic side effect. Injectable disease. Injectable nanocarriers are employed in antiviral, antibacterial, and anti-thermal. Sorry. Next, injectable disease. Injectable nanocarriers are employed in antiviral, antibacterial, and antifungal therapies. Okay, therapies and enables the localized treatment at the infection site, especially for the chronic chronic infections. Next, gene therapy. Nanocarriers such as exosome and lipid nanoparticles are used to deliver the genetic material, such as DNA and organic, to the target cell for treating the genetic disorder. Next, neurological disorder. For example, Alzheimer and Parkinson. These are the very harmful diseases, and these diseases are not treated with the traditional method. That's why we use the injectable nanocarrier to treat these diseases. This is the example of injectable nanocarriers. Now we discuss the oral delivery of nanoparticle. In this system, we deliver the nanocarrier through the digestive tract. Okay, the aim of this oral delivery system, the aim of this approach is to improve the drug stability, absorption, and bioavailability of drugs. Okay, now we discuss the benefits of oral nanoparticles delivery. First, to improve the bioavailability of poorly absorbed drug. For example, there are a lots of drugs, there are a lots of hydrophobic drug. Okay, these are the poorly soluble in water. But by the help of nanoparticles, we easily improve the absorption quality of these drugs. Next, protection of sensitive drugs. There are a lots of drugs that are based on a peptide. These drugs are very sensitive, but by the help of nanoparticles or nanocapsulation process, we protect these sensitive drugs. Next, patient convenience and compliance. Next, patient convenience and compliances. Oral delivery is often preferred over the injectable, particularly for the chronic therapies. Next, control and sustain release. Nanoparticle can be engineered to release the drug gradually, ensuring the sustained therapeutic level over the time and reduce the dosage frequency. These are the benefits of oral nanoparticle delivery system. Now we discuss the application of oral nanoparticle delivery. First, in cancer treatment. Nanoparticle carry the chemotherapeutic agents. Okay, and we design this chemotherapeutic agent for target release the drug into the tumor cells. These nanoparticles carry the chemotherapeutic agent, and these agents can be designed to target release the drug into the intestine, and this minimize the systemic toxicity of the cell. Next, diabetes management. Researchers and scientists are exploring the nanoparticles for oral oral insulin delivery to eliminate the need of injection of insulin into the body. Okay, next, anti-inflammatory drugs. Nanoparticle system can target the inflammation in the gastrointestinal tract for conditions like inflammatory bowel disease, and releasing the drug target at inflamed site to reduce the side effect. Next, vaccine delivery. Oral vaccine using the nanoparticles has been exploited to stimulate the immune response via the gut associated lymphoid tissues, offering a needle-free immunization route. Offering a needle-free immunizing route. Oral vaccine using the nanoparticles has been exploit to stimulate the immune response via gut-associated lymphoid tissues. Okay, first we use this in cancer therapy. We directly transfer the chemotherapeutic agent into the intestine and minimize the systemic toxicology. Next in diabetes management. We use this oral nano carrier delivery system to eliminate the need of injection of insulin direct to the body. Next, anti-inflammatory drugs. In drug delivery, oral nanoparticle delivery system has been exploited. Next, in vaccine delivery. In vaccine delivery, oral nanoparticle delivery system stimulate the immune response via the gut-associated lymphoid tissues. Okay, these are the application of oral nanoparticle delivery system. Next, we discuss the benefits of nano carrier. First, increase the efficacy with low dose, minimize the side effect, improve the pharmacokinetics and biodistribution of drug. Next, flexibility in formulating a wide variety of drugs. These are the benefits of nano carriers. Nano carrier administration. Next, we discuss the application of nanotechnology based drug delivery system. First, to treat the cancer. By the help of target drug delivery system, we treat the cancer. Next, neurological disorder. By the help of nanoparticles, we easily treat the neurological disorders such as Alzheimer. Next, infectious disease. Infectious disease to treat the infectious disease, we use the nano carriers. Next, gene therapies. Nanotechnology or nanocarrier can easily deliver the DNA, RNA, and CRISPR, that is a gene editing component, into the target cell for treating the genetic mutation. These are the application of nanotechnology in a field of drug delivery system. These are the application of nanotechnology in drug delivery system. Now we discuss the challenges and consideration. First, safety and toxicity. Next, manufacturing complexity. Next, regulatory hurdles. Okay. First, safety and toxicity, the impact on non-targeted cells and long-term effect need the evaluation. First, safety and toxicity, the impact on non-targeted cell and long-term effect need through the evaluation. Next, manufacturing complexity. Scalable and reproducible manufacturing processes are essential. Next, regulatory hurdles. Approval process can be complex due to the advanced nature of nanocarrier system. These are the challenges and consideration. First, safety and toxicity, manufacturing complexity, and regulatory hurdles. Okay, these are the challenges and consideration. Please follow ITLS Academy on Facebook, Instagram, Twitter, YouTube, WhatsApp, and also get it on Google Play Store. Thank you so much for watching my video. Please like, share, and subscribe ITLS Academy. Thank you.